Achieving Heart Rhythm Excellence. Since 1985, IBHRE has been at the forefront of promoting a global body of knowledge among heart rhythm specialists and has become recognized as a leading credentialing board in heart rhythm management, maintaining global relevance, impact, and influence.
As IBHRE comes upon its 35-year anniversary, it is important to understand that IBHRE has changed with the times. Starting off as the North American Society of Pacing and Electrophysiology, or NASPE, it is now morphed into the International Board of Heart Rhythm Examiners. We now are not concerned just with the North American physicians, technologists, engineers, and other caregivers, but those from an international arena. In addition, our exams have expanded as time has gone on, and the content is constantly being revised, such that examinations today bear very little resemblance to examinations of 35 years ago. As electrophysiology, as device therapy has advanced, so have the contents of our examination to keep up with the changing times.
IBHRE certifies the Heart Rhythm Management Team. To date, we have certified more than 10,000 individuals in more than 50 countries. IBHRE certifies physicians, nurses, industry representatives, educators, lab technicians, and other allied professionals.
Continuous evolution with an ever-changing field.
IBHRE has evolved with the field of heart rhythm management by welcoming an entire community of caregivers from nurses, allied professionals, industry representatives, and physicians. I think it has a continued focus on education and lifelong learning. I think that's important to really maximize the quality of care for our patients, to make sure they're getting the most up-to-date contemporary care, but also from professionals who are committed to continuing that learning process throughout their career.
One of the things that IBHRE has done to help keep up and stay current is that there is now an expectation, instead of taking an exam and repeating it every 10 years, that certificate holders do need to document continuing current education in order to maintain that certification. And I think that's important, so that because the field's so rapidly moving, things change so quickly in 10 years.
IBHRE is able to keep up with technological changes by engaging experts in its test writing committees, and the exams are constantly upgraded to reflect current changes in practice as well as technological changes.
The field of electrophysiology has grown phenomenally in the past 4 decades, and IBHRE has not only been along for the ride, but it has helped drive the train. By keeping us current, by keeping our knowledge level high, together we have been able to advance care so that patients ultimately get better health long term.
IBHRE-certified, delivering improved patient care.
There are many different kinds of people who care for heart rhythm patients. There are physicians, nurses, technologists, and even more broadly, the people who create our devices for us, and the people who manage patients within the cardiac electrophysiology laboratories. Having people who have passed an examination that shows that they have a level of competency that puts them ahead of and apart from people who don't have that degree of knowledge is a very important issue.
The exam was probably the hardest board examination that I've ever actually taken because it's very, very demanding. But I can tell you that the process of studying and eventually passing that examination really taught me a huge amount about device therapy. Stuff that I really was vaguely aware of in my normal training and my normal practice, but actually having to study for the examination brought me to a place of a much deeper and much broader understanding of the field.
My IBHRE credentials had direct and indirect positive impact on the patient outcomes. Directly, I would say, leading the follow-up device clinics, troubleshooting and ensuring appropriate programming of the implantable cardiac devices, optimizing using 12-lead ECG and echocardiogram of the biventricular devices, addressing anticoagulation, rate control, rhythm control at appropriate timing. I think these are the areas where IBHRE credentials had direct impact on patient outcomes.
It allows somebody to really get to the essentials that are required to help manage patients, sometimes with very complex problems. I think it also gives a reassurance to the patient that they have a committed professional who is taking responsibility for their care, explaining to them details of their care, and providing that care in a very, I think, a very dedicated fashion.
Advancing the careers of heart rhythm specialists.
Having IBHRE certification has put me in a position to advance in my career. I've been able to do some consulting on different electrophysiology subjects. I've had opportunities to provide extra educational programs to my peers and to people in the community. And it's just given me a lot of confidence in myself and being able to give of myself to the people around me and to be able to improve their lives and their health, especially related to electrophysiology.
IBHRE has contributed to my career because it continually updates the standard that needs to be met. So I can proudly point to it and say that I meet that standard. And I know that that will instantly be recognised by my colleagues.
Cardiac device specialist is a great benchmark. I know that if I have somebody else in the room who has the same certification as myself, that you have a certain minimum standard of understanding.
To anyone considering doing the IBHRE, I'd say do it and meet the standard. The bar is continually being upped, and that forces you to prepare to be able to meet that. But most of all, be proud that you're doing the best you can for the patient.
Certification by the IBHRE tends to make physicians and other caregivers push themselves to study and to become current on device therapy or electrophysiology therapies and diagnostics. In order to sit for an examination, one has to perform many hours of study in preparation. And by doing so, we increase our base of knowledge, and it becomes a personal success that we are able to achieve that level of certification. By doing so, we have pushed ourselves to understand our field, our patients, and having expanded our knowledge base, we have demonstrated once again that we are committed to our field of endeavor.
Learn more about IBHRE's distinguished history at ibhre.org/history.